In today's video, I am going to be teaching you how to calculate your menstrual cycle length, your safe days to avoid pregnancy, and your fertile days to get pregnant if you are trying to get pregnant. So I am going to make this video as detailed as possible. I want you to understand it. If there is a part that you don't understand, please pause it and rewind it to make sure that you get it right. So I am going to be using these items, and I am going to be using this green for your fertile days. These are days that you can have sex and you are most likely to get pregnant for those that are trying to get pregnant. And I'm going to be using this blue marker to mark your safe days for those that are trying not to get pregnant. So these are the days that you can have sex without protection and you are not likely to get pregnant. And then I am going to be using this black marker to mark your cycle length so that you'll be able to understand your cycle length. And I'll be using this pen to put down notes. So we also have a calendar. I am going to be using this calendar. We are going to be writing on this calendar and we are going to be marking these days on the calendar. So let's get started. If you are new here, my name is Jade. In this channel, I talk about everything fertility, pregnancy, motherhood, parenting tips, and everything baby. If these are things you're interested in, please subscribe. Thank you. Let's put a name to it so that you can understand it better. Let's say Jovita saw her menstruation in December, and it started on the 2nd of December, and she saw it for 5 days. That's 1, 2, 3, 4, 5. And then the next time she was seeing her period was 30th of December, and it also lasted for 5 days. That's 1, 2, 3, 4, 5 in the next month. So now Jovita's cycle length is going to be counting from this first day to the day before the start of another menstruation. So let's count together. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. So Jovita's cycle length is 28 days. So this is how you calculate cycle length. And a normal cycle length ranges between 21 days to 35 days. So if you have below 21 days or you have above 35 days, it means that you have an abnormal cycle length. So now we have established that Jovita has a 28-day cycle. So we're going to write 28 here. And then we are going to subtract 14 from the 28. The reason we are subtracting 14 days is not because 14 days is the middle of Jovita's cycle length. If Jovita has 30-day cycle length, we will still subtract 14 days. So let me tell you the reason. The cycle length has 3 phases. We have the menstrual phase, the follicular phase, and the luteal phase. The menstrual phase is the first day your menstruation starts. The uterine lining is being shed, and then it comes out as menstruation, that's period. In the follicular phase, there is a hormone sent from your brain to tell the follicles on your ovaries to start producing, and then it starts growing. They start growing. The most mature ovary is then released, and this ovary is expected to be fertilized by a sperm. But in the case that there is no fertilization, it will be reabsorbed within 12 to 24 hours after the ovary is released. So the time that this ovary is being released, so the time you start seeing your next menstruation is called the luteal phase. So many literatures have said that this phase consists of 14 days. So now you see the reason we are subtracting 14 days. But it's not actually 14 days. It ranges between 11 to 17 days. So that is why even if we know the day that you are supposed to ovulate, we still give it a grace period of plus or minus 2 days. So now you know the reason why we are subtracting 14 days. Now back to our calendar. So we are going to subtract 14 days, which we know why now, away from 28 days. And if you subtract 14 from 28, we would have 14. So meaning Jovita is supposed to ovulate on the day 14 of our cycle. So day 14 now, if you look at when we counted, if you look at 14, so day 14, this is day 14 of our cycle. So Jovita is expected to ovulate on this day. Remember we said because of the range, we are going to do plus or minus 2 days grace. Plus or minus, because it's not always 14 days. So meaning she can ovulate also on this day. It's possible to ovulate plus or minus 2 days. Plus or minus 2 days. So meaning she can also ovulate on this day. She can ovulate on this day. This plus 2 days. Then minus 2 days, meaning she can also ovulate on this day. And she can ovulate on this day. So these are the possible days that Jovita can ovulate. And sperm can last in the body for 3 to 5 days. Sperm can last in the body for 3 to 5 days. So now that we have established that sperm can last in the body for 3 to 5 days, it means that if Jovita has sex on the day 8 of her cycle, she can possibly get pregnant. Because if she's going to be ovulating on the day 10, on the day 12 of her cycle, she can likely get pregnant. So we will also count all of these days as days that she can possibly get pregnant. She's not ovulating on these days, but she can possibly get pregnant on these very days. So we are going to cycle them. Now, these are the days that Jovita is going to possibly get pregnant. So these are going to be considered her fertile days. And fertile days in a cycle, in every woman's cycle, is usually 9 days. So let's count if we have 9 days. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9. So if she had sex any of these days, Jovita she has a high chances of getting pregnant. So these days are your fertile days. These days are your fertile days. If you don't understand, please rewind this video, pause it and start again so that you can get this explanation very well. So just a little recap. Remember we said your cycle length, you will know how to calculate that, minus 14. We got 14, and this is day 14 of Jovita's cycle. This is the day she's most likely to ovulate. But because there has been researches that shows that this 14 days ranges, we usually give it a grace period of plus or minus 2 days. And if you put plus or minus 2 days, plus 2 days will be she can either ovulate this day or she can ovulate this day, and minus she can ovulate this day and she can ovulate these days, and sperm can stay in the body up to 5 days. So if she's possibly going to ovulate this day and she has sex this day, this is at most 1, 2, 3, 4, 5. So she still has some chances of getting pregnant. And then the most day that it can come, that ovulation can come, is on the day 16 of a cycle. So these are the fertile days. These are days that if you are trying to conceive, these are days you should be actively having sex. If you can have sex every day, then go for it. But if not, you can do alternate days. It's advisable you have sex at least 4 days of these days that are here. That is if you are trying to get pregnant. But for those that are trying not to get pregnant, so these other days that is on this calendar are your safe days. These are days that you can have sex and the chances of you getting pregnant is very slim. So these are the days. So these are your safe days till the start of another cycle. See that your safe days are more after your ovulation and less just right after you menstruate. So your fertile days are closest to after your menstruation, and then you have your safe phase. I hope you understand this, and if you don't understand it, please play this video over and over again so that you can understand this part.